Hello and welcome to Patho Excellence. Today we are talking about Trichomonas vaginalis, its diagnosis and clinical significance. What is the significance of reporting Trichomonas infection? One is, in this infection, the superficial and intermediate cells may show some atypical change, including nuclear enlargement, hyperchromasia, cytoplasmic vacuolization, sometimes binucleation, and inflammatory halos. So, this may confuse us as cervical carcinoma features. So, we should be aware in reporting such lesions. Second thing, recent studies have proposed that this infection may increase the risk of HIV-1 acquisition. And third thing, it may be associated with adverse pregnancy outcomes. Hence, one should emphasize care while reporting smears with Trichomonas. What is Trichomonas vaginalis? It is a primitive eukaryotic organism, a parasitic protozoan that cause trichomoniasis, which is a sexually transmitted disease, and sometimes accompanied by a non-pathogenic long filamentous bacterium called Leptothrics. Essentially, it is a pear-shaped eukaryotic organism, a parasitic protozoan. It is primarily a disease of women, though it also occurs in men, and clusters of these organisms are colloquially called as Trich. Mainly affects women from ages 16 to 35 years, but can occur in postmenopausal women, strongly associated with increased risk of HIV acquisition and transmission. Most prevalent non-viral sexually transmitted infection and mostly preventable. Common sites in female lower genital tract like vulva, vagina, cervix or urethra, and in male urethra, epididymis and prostate. The patient presents to us. The symptoms are burning, itching and foul-smelling vaginal discharge, but sometimes 50% are symptom-free. There will be microscopic punctate hemorrhage on the cervix that will give a strawberry-like appearance to the cervix. For the diagnosis of strawberry cervix, there are different tests available. One is pH test, in which if pH level is higher than the 4.5 or less, then it is indicate an infection. Whiff test, it is the fishy odor of the vaginal discharge, which is suggest positive test. And the wet mount preparation, it is the diagnostic test. Its sensitivity is ranging from 50 to 90%. A small amount of this discharge will be used to make wet mount preparation, and in this smearing we can see rapidly moving organisms, which is Trichomonas vaginalis trophozoite. For the diagnosis, different tests are available. One gold standard test is nucleic acid amplification test. It is called NAT. Second, awesome Trichomonas rapid test. It is immunochromatographic test that detect antigen from the vaginal swab. Third is DNA hybridization test. And fourth is microscopic examination of secretions like pap smears and wet mount. Culture was considered as a gold standard before the availability of molecular test. Life cycle of T. vaginalis having three stages. One is diagnostic stage, second is Trophozoite multiplication stage, and third is infective stage. Cytologically description, if we see, it exists in only one morphological state called trophozoite form. You cannot encyst or form cyst, having 15 to 30 micrometer size, pear-shaped. Nucleus is small, round to oval with very pale eccentrically placed. Cytoplasm often contains vacuolization and sometimes red granules. Clusters of these organisms are colloquially called Trich parties. It's sometimes accompanied by leptothrics, which is in the combination called spaghetti and meatballs. Three-dimensional cluster of neutrophils called polyballs may be seen in the background. Sometimes lymphocytes and mast cells may be seen. So here you can see the diagram of trophozoite, pear-shaped, 10 micrometer to 30 micrometer size, clear nucleus eccentric placed with delicate nuclear membrane, 4 pre-flagella antibody and 1 flagella is attached by undulating membrane. This is exostyle. Clear vacuolization in the cytoplasm, sometimes containing bacteria and herbices, and no cyst form is identified. In wet mount or unstained preparation, it's look as a colorless, having nucleus generally invisible and exostyle as a highlight. When we prepare wet mount preparation, in which the is moving or pear-shaped in appearance, refractile in nature. Even in urine examination, when it is in the groups, we can see as a rapidly moving organism in the preparation. These are the forms of the Trichomonas vaginalis. In the stain slide with the pap smear, pap stain shows these are the small pear-shaped appearance of the Trichomonas vaginalis. These are the squamous cells, mostly intermediate, few superficial squamous cells. Background shows RBCs and neutrophil with the dirty appearance, and these are in red circle. You can see Trichomonas. This is again a cervical smear containing plenty of squamous cells. These are the Trichomonas. Neutrophil RBC. Here also you can appreciate Trichomonas, and this is the group of or cluster of the Trichomonas is called Trich party. In higher magnification, you can appreciate these are the Trichomonas collection. So these all red dots suggest the presence of Trichomonas, and this is the squamous cell. This is Trich party. This is again higher magnification showing pear-shaped Trichomonas with very pale stained nucleus, some vacuolization in the cytoplasm. This is the long Leptothrix bacillus and the squamous cell. Here you can compare the size of the nucleus with the squamous cell. So this is the large in size, dark in color, small and pale in color. He said when you find the spaghetti, search for meatballs too. So Leptothrix, they are the like spaghetti, elongated, and here the presence of Trichomonas. So both are together called meatball and spaghetti appearance. Same thing, this is the intermediate squamous cells, superficial squamous cells. This is Trich party. Here the Trichomonas has all have covered the squamous cells. They are adherent to the squamous cells, and this is the spaghetti form or the leptotrix bacilli. Polyballs means aggregation or tight cluster of neutrophil due to this infection. So multiple polyballs you can appreciate here in the pap smear. Higher magnification view shows polyballs, some squamous cells, thinly scattered polymorph and RBCs, and these are the Trichomonas. Trichomonas associated changes in squamous cells are very much important because sometimes these features are so atypical that we can confuse it with the cervical carcinoma. So one is Trich halos. So this is the inflammatory perinuclear halo or pale staining of the cytoplasm or narrow zone of clearing around the nucleus, which is particularly seen in the Trichomonas infestation. So it is called Trich halos or inflammatory halos. It mimics koilocytes, but it's not true koilocytes, so it is called Pseudokoilocytes. And by definition, the width of the inflammatory halos between the space between the nucleus and cytoplasm is less than the diameter of an intermediate cell nucleus, and the outline or the boundary of this halo is often poorly defined. So this is inflammatory halo. True halos of koilocytes are much larger, more sharply defined, and their nuclei are big and big. And sometimes in the squamous cells, infected smear shows vacuoles and polymorph in the vacuoles of the squamous cells. Here you can appreciate this red arrow shows Trichomonas and very beautiful inflammatory halo. Here the nucleus and narrow zone of clearing around the nucleus having vague boundary and very small in size, right, as compared to the nucleus of the squamous cell. This is called Pseudokoilocytes, and this is the true koilocyte. Here you can compare the large perinuclear clearing or halo, nuclear irregularity and enlargement, and sharply defined border of the halo. So this is how you can appreciate inflammatory halo. These squamous cells contain vacuoles, and inside the vacuole there is engulfed leukocyte. This is again Trichomonas. So differential diagnoses include cell fragments, cytoplasmic debris, bare epithelial nuclei, small mucus aggregates, and disintegrated lobe of leukocytes. This gives us, or this mimic as Trichomonas. So at that time we have to be careful by identifying its definite elliptical nucleus, sometimes helpful in avoiding misinterpretation. They are mostly adherent to squamous cells. Presence of eosinophilic cytoplasmic granules along with vacuolization, and sometimes these are plentiful or called Trich protein. So these are all features helpful in identifying true trichomonas. So by conclusion, we can see if pear-shaped, pale staining, trophozoite with pale nuclei, sometimes adherent to squamous cells, presence of polyball and leptothrics, then it is Trichomonas vaginalis infection.